Psychiatric treatment for children and adolescents necessarily requires medication.
Of course, this is a myth that isn't true. With children and adolescents, we usually prefer to approach treatment through conversations, therapeutic talks, which can be with a social worker, a psychologist, a female psychologist, or a psychiatrist, also involving the parents. But the process will first and foremost be conversational, psychosocial, as we call it in our field. Medication is a second line. It could be that at the same time, together with the psychosocial treatment, sometimes we will give medication right away. It depends on the severity. In mild and moderate cases, we prefer not to start with medication in the vast majority of cases. Usually, we give medication for different situations like depression, anxiety, behavioral problems, psychosis. There are endless indications. And depending on the indication, that's also how common the use is according to age. That is, attention deficit disorder, which often appears at a very young age. Sometimes we can even give the treatment in kindergarten or first grade and onwards. Other disorders that are more common in adolescence, like depression and anxiety, which also exist in young children, but the prevalence increases as we enter adolescence, so we give it to children who are a bit older, teenagers, and it really varies depending on the disorder we're treating. In summary, treating children and adolescents for psychiatric disorders or emotional difficulties does not necessarily require medication. There are many modalities. There is therapy for parents, therapy for the child through conversations. There are psychoeducational interventions. Medication is just another layer that we don't always use, and sometimes it's not the main thing at all.